Good morning and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self at KMET 1490 AM, ABC Radio, ABC News Radio. This is Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in beautiful Encino, California. And this morning we are going to welcome back my wonderful friend, best friend, wonderful colleague, business partner, and many more, Dr. Robert Jaffe.
Thank you very much.
Welcome back.
Welcome. Thank you.
We truly missed you last week.
Oh, thank you.
Yes,
that's so sweet.
Yeah, you're welcome. I mean, I did follow your lead about your topic, and I tried to stay with that.
Okay, good.
To the best that I could, and I hope that our listeners benefited from that. However, I know for sure they miss having you here.
Oh, well, I missed being here. Yeah, so we've been talking a lot about addictions and codependency, and we've identified codependency as actually an addiction. It's not, of course, a drug addiction, but it's an addiction to a view of the world and the way that we treat others, and especially the way we treat our significant others.
So that's an introduction to your usual introduction.
That's an introduction to my usual introduction. Right.
So, Dr. Jaffe, tell us what you do.
Okay, I'm a licensed marriage and family therapist, psychotherapist. I do clinical hypnosis, and I've been doing it for a long time, since licensed since 1984.
More than my lifetime.
No comment.
No.
And I specialize in the treatment of addictions and also trauma, which oftentimes accompanies addictions, and relationships, as do you. And so that's what this program is devoted to. It's about talking about what addictions are, and we've been talking a lot about codependency because it's the most common addiction, but people usually don't think of it as an addiction, and they also don't really understand what that means, codependency. What is codependency? So we've been talking a lot over the past couple of months about addictions, and especially about codependency.
Yeah, I like to say, codependency is such a pervasive phenomena in life, right? It doesn't just happen overnight or within a month or so. As we have talked about it, the fundamental aspect of it, begins in childhood, in infancy even.
Correct.
Right. So it's one of those pervasive addictions that gradually, grows with the person, and then the individual may not even know that they are a codependent. However, when they notice that is when they are not happy in their relationships, when they're not happy. I mean, when I'm talking about relationships, I'm talking about work, I'm talking about siblings, I'm talking about friends and marriage, other relationships, romantic relationships. When they see the discomfort there, that's when they pay attention, Right.
Right.
So that's the very first time. So it's one of those addictions. It's not like alcohol or drugs or, anything else that you see the immediate side effect of it, unfortunately.
Right. And I think most people realize, excuse me, I think most people realize that addiction doesn't have to be a chemical addiction, doesn't have to be to drugs or alcohol, because most people recognize that gambling is a profound addiction, and there's gambling has expanded into the AA model, so there's Gambling Anonymous. And so we know that addictions are things that are other than drugs and alcohol. But people don't recognize that codependency is a form of addiction because it's so ubiquitous, it's so common, and it just seems like that's the normal way people are.
Right.
So people just live in a codependent reality where they don't think that there's anything wrong. And of course, as long as everything is going smoothly, then at least on the surface, then there is nothing wrong. And as you just commented, only until there's a problem and they start seeking help do they recognize that there's a lot beneath the surface. Right. So, we've been talking a lot about defining codependency, and just briefly for those of you who are just tuning in now, codependency we are defining as a dis-ease, and I'm using the word dis-ease, not disease, but dis-ease of lost selfhood.
Right.
And that means that you define yourself through how others view you. And so if people are thinking highly of you, you think highly of yourself. And if people are upset with you, then you don't feel good about yourself. And people go, well, isn't that the way it's supposed to be? Isn't that normal? And again, I'm going to say, it is in a sense normal because it's ubiquitous. It's how a lot of people, and maybe even the majority of people, actually experience life, is they see this themselves through how others view them.
Right.
And that's why we say it's a dis-ease of lost selfhood, because in a functional family, you learn to see yourself more as who you really are, rather than as how others treat you.
Yes. Yeah, I also say, it's a disease of looking elsewhere for happiness.
Yeah. It's a disease, meaning that
looking outside yourself.
Yes. So, and so you're then dependent on other people and outside circumstances to make you happy. So if you get a raise at work, wow, I'm happy. If they tell you you're not doing well at work, wow, I'm really unhappy. And people do that with their partners all the time. So if their partner is upset with them, then they're not happy. And I'm going to say that if your partner is upset with you, that doesn't mean that you have to jump up for joy that your partner is upset with you. Of course, you're concerned, but it really doesn't have to affect your level of self-worth, self-esteem, and even happiness.
Right.
So that's basically self-esteem. Again, it's a disease of lost selfhood, and it comes usually early in life, and it starts with parents thinking that they are and you are just the behavior, and your emotions are a side thing, and you notice your emotions perhaps, but you don't attach any value to your emotions. So it's the behavior that matters, and that's what codependency is. So if you're a child and you're going to school and you're getting straight A's, your parent may say, well, my child is very well adjusted, they get straight A's. But actually, no, straight A's does not indicate that you're well adjusted. It simply means that you're getting straight A's. But it has nothing to do with how you feel inside. And there are people who get straight A's and feel great about themselves, and there are people who get straight A's and feel horrible about themselves.
Right.
Yeah.
Because they don't feel that's enough. I actually have some clients that they have experienced that growing up, where they receive, for example, an A, but they were told, how come it's not an A+?
Yeah,
right?
Yeah.
And they have been compared to other students. How come this other student is able to get an A+ and you're just getting an A?
Yes, yeah.
Right.
Yeah, or and I've had clients like that also, where they come home with all A's and one B, and there's nothing said about the all A's, right? It's, oh, you got to be in math. What's going on there?
Yeah, that B is magnified as though
as though it were an F.
Right.
Yeah.
Exactly.
Yeah.
But all the other accomplishments, if that in fact an A is a sign of high accomplishment, those were not commented on or valued, but that be, yeah, I mean, this is how people lose the reality of who they are.
Mm-hmm.
And then they aim to be like everybody else.
Right.
Because they are better version of them.
Right, right. And so what we have in life then is we have, can't seem to clear my throat. Okay, what we have in life is people walking through life who believe that they are their accomplishments, and therefore they become super achievers, and they make tons and tons of money, and they. Is this water?
No, that's warm tea.
Oh, warm tea.
Yes.
All right, I'm going to have a little sip.
That's why I put it in front of you.
Thank you.
You're welcome.
And they go through life and they become overachievers, and they become sometimes very wealthy. Sometimes they rise to great positions in power, in politics, and they have very high opinions of themselves on the surface, but underneath it masks a terrible feeling of inadequacy. And these people are especially vulnerable to other people criticizing them.
Right.
So they can't stand criticism. And the reason that they can't stand criticism is because underneath they're afraid that the criticism is accurate. And
that's their reality.
Their reality
yes.
is, yeah. So then they have to protest. There's a saying, thou protestest too much, right? And why do you protest so much? You protest because you're fighting the fact that you are buying into it. If someone says, if I say to you, Dr. Rashidi, and I know you're secretly a man.
Am I?
Secretly a man, yeah. And I know that before we ever met each other, you had that sex change operation. By the way, they did a really good job on it. You have all the qualities of a man, and I can sit in here and talk about all the things that are man-like about you. And so if you know that is true, if you know that that's ridiculous, you don't have to get defensive.
Right.
Right. You just go, oh, okay, well, that's what you think.
Right.
So
incidentally, that's what I was just thinking.
So that's
I'm so sorry for you.
So anyway, that's an example of why you don't need to be defensive if you know that the other person is saying something that is wrong.
And it is subjective.
And it's subjective.
Right.
And, yeah. But what if you thought, no, I'm really not a man, but other people think I'm too much masculine and I'm really not feminine enough, and you're holding on to that belief.
Are you giving me a hint?
Then my saying you're a man might be something that touches something in you, and then you might become defensive. So
okay.
Anyway, so that's how it works, and then so we look at other people to define us, and so today I thought we would talk about how we can recognize things within us and begin to heal from codependency, because we've done a little bit of that, but today I'd like to devote more of the program to the healing from codependency. And so that's what we're going to talk about, the authentic true self, when we come back from break. Okay. We're going to talk about how to recognize when you're codependent and how to begin to heal from it. That's what we're going to spend our time doing today.
Looking great, and looking forward to it. See you shortly after our commercial break.
See you soon.
Have some. Welcome back from our commercial break. Dr. Mitra and Dr. Robert here. This is Heart to Heart program at KMET 1490 AM ABC News Radio. If for those of you just tuning in, our discussion for this segment is about codependency, the disease of lost selfhood, with Dr. Robert. And we would like to thank you for joining us, and please share this program with those that you believe they can benefit from it. And also, please call us 951-922-3532, 951-922-3532. This show belongs to you and your loved ones if you wish for them to listen to this. And also, you can watch us on our YouTube at heart-2-heart.online/YouTube. And if you're the fourth caller today, you're going to receive a 15-minute free consultation offline with either myself or with Dr. Jaffe. And thank you for giving us your hour this morning. Dr. Robert, we were talking about the disease of lost selfhood, the disease of looking elsewhere for happiness.
Right, and we're going to be focused on today on healing from codependency. We've talked quite a bit about what it is. And you say a disease, and I say a disease of lost selfhood. So I'm going to pose some questions during the next 40 minutes or so, the remainder of our program, to the listeners. And as you know, as listeners, you can ask yourself if this is accurate or if this is true. And the first question that I'm going to pose to you is, how safe was it in your family of origin, okay, which is usually where codependency originates? How safe was it to talk about something that was very emotional for you? For example, if you felt if your parent raised their voice or yelled, were you able to say, you know, when you yell at me, it hurts my feelings, or somebody picked on me at school? How safe was it for you to talk to your parents about what was real to you? I'm having a tough time in math class. I think my math teacher hates me. Anything that was going on in your life, were you able to talk about it? And if you were able to talk about it, then what kind of response would you get from your parents? So in a functional family, it's much more important to tell the truth than to say what's politically correct or what you expect the other person to hear. So the truth is valued as more important than anything else. And of course, as children, we are all totally dependent on our caregivers. Just for the sake of the program, I'm going to say your parents or your people.
Your caregiver.
Your caregivers, or whoever your parents were. Whether it was a step-parent, whether it was a grandfather, grandmother, they were in the role of the parenting role. And so when your parents would speak with you, would they speak with you as though you were an equal, or would they talk down to you? Did they have a positive view of you as a positive person, as a good person, as a caring person? Did they treat you as though you didn't know anything? Did they tell you what to do, or did they say to you, okay, here's our routine, and now it's up to you. Now you can do your routine as you aged, as you got older? Were they very controlling of your behavior? So the more freedom that you got to be yourself, the less you had to contort yourself into a pretzel in order to fit in with them. And we call the contorting into a pretzel, we call that the codependent reality. I'll be who you need me to be. And what I was saying a minute ago was that we are all dependent when we come into the world, and we need our parents' approval, and we need our parents' support. We need our parents' love. And what happens if we don't get it? Then we do whatever we need to do in order to survive in that environment. And that is usually either agreeing with our parents totally and seeing things from their viewpoint, or not agreeing with them but pretending to go along. Or and so once we start pretending to go along, then we do have to still turn ourselves into a pretzel to fit in. And if we do agree with them and we don't start, and we learn not to think for ourselves, then we are also becoming codependent, because they are our leaders, and we are simply the proletariat, the followers, the people without power. So so it's our parents' role to empower us, and when they don't, then we learn, in order to survive in that family, because I need my parents, because I can't go out and make a living, and I can't do a lot of the things that they can do as grown-ups. I have to then pretend to go along, or I can fight them, and then if I fight them, then I keep getting smashed, and then I lose my sense of ability to take care of myself.
So that is absolutely perfect picture of what a codependent is. And I want to add here that cultural factor also significantly contribute to this. There are cultures where you absolutely, as a child, cannot be anything else but your culture. So we're talking about, the very prime culture, which is at home, and also the secondary culture, which is outside home, right? However, I want to also bring in the point that the culture within home, the prime home, also is a significant follower of the culture outside home.
Yes.
So they bring the parents, which are the prime source of cultural teaching. They're teaching not only what they believe the culture has told them, has taught them, right? But they're also, so in other words, their own introjects. This is what we call it, introject, right? Not only they impose that on children, but also they kind of reinforce the outside culture. So the children, when they go out, they're already programmed to function exactly as that, right? And I don't know why the phone is ringing. I don't have it here.
Okay, well, we'll let it ring until it picks up. Yeah.
Yes. Okay.
Yeah.
My apology for that. I don't know what to do with it.
Well, just continue. That's okay.
Right. So in collective cultures in particular, that's what I meant to say. Children, if they want to step outside cultural boundaries, whether that's within home environment or outside in larger society, they are exposed with such a profound feelings of shame and guilt and sinfulness of why they are not complying with cultures. And that's not only during childhood. The more they grow, the older they get, that cultural imposition becomes stronger.
Right.
Because incidentally, as children, they can get away with some of the cultural do's and don'ts. However, once they become a teenager and a young adulthood, and after that, they are that's by the law of their society, or subjective society, subjective laws, I mean to say, that if they are anything but their culture, then there is a shame, there is a big shame for the family, there is a big shame, big guilt for the family, as well as themselves. And society absolutely very clearly looks down upon them.
So you come from that kind of culture,
right?
And can you give an example to the audience as to what that means? How does that play out?
Well, for example, respecting the elder, respecting parents, for example, right? That's a universal policy. That's a universal rule, right?
Yeah.
That we need to respect our parents, and nobody wants to disrespect their parents. However, the respecting parents, it's different than not stating your opinion.
Right.
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 But in some of the collective culture, you can't even disagree with the opinion of the parents, whether you want something to do or you don't want to do something, right? And this goes as far as even, choosing what you love to do for your life, like choosing the field of study you want to go to for your education.
You mean it's selected for you?
It is selected for you, right?
Right.
There are cultures that your spouse is selected for you.
Right.
It's selected for you to get married while you are still a child under the age 18, right? And so these are some of the cultural factors that if the child disagree with, it's like a crime.
Right.
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 And then the child becomes a codependent because there is no other alternative.
And the codependent means that you have to be. Are you saying codependency, for example, in your culture, means that you're obedient?
Obedient and at all costs.
At all costs.
At all costs.
Right.
You like, for example, in particular, a female, right? A female has to follow a family rule, and then when she goes to her husband home, now she has to follow not only parental rules and policies, it's the spouse policies and his parents policies, the in-laws. Right. So it's kind of becomes a more trapped environment for the individual female, now as a daughter, now as a wife, and now as a daughter-in-law, right? So the circle becomes tighter and tighter and tighter, and the individual doesn't get even a chance to experience a life that is not codependent.
Right.
And many of them, they won't even experience, they won't even know about it. However, they continue to live in an unhappy life, and they believe that that's it, that's life for everybody.
Right. Now, I also want to comment that each individual is unique.
Yes,
right.
Absolutely.
And just because you have been raised in a family that let's say what we call a dysfunctional family, where obedience is valued more important than truth. Obedience is valued more important than making decisions, and obedience to the culture means that they set you up with a future husband, and just because you're raised in that culture, it doesn't necessitate that you are going to go along with everything, or that you can, and that you can't free yourself from that, as you are evidence of that. Because you were raised in that culture. I'm not saying you weren't negatively affected, but I'm saying you were raised in that culture. You were set up with the first husband. You did not go through with it, and you have actually gone against your culture in many, many ways.
Yes, I have.
And that has to do with you as a unique individual. But that doesn't mean that everyone is able to do that.
Exactly.
Yeah.
Not everybody is able to do that. Most people don't believe that they can do that.
Right.
And of course, me going against the culture and against some of the decisions that they were planned for me, and I had nothing to say about that. I just had to obey. It wasn't without penalty. However, I accepted the penalties in exchange of of my freedom.
Yes.
Right.
Yes.
So that is not easy for everybody to do. Many people, they rather just stay where they are, and then just continue life that way. And I'm not one of them. I wasn't one of them.
Yeah.
So how I become lucky like that? It was the act of God, I would say.
Well, that's what I'm saying. Each person is unique.
Yeah.
Yeah. So.
And I'm talking about sexuality. I'm a sexologist, so that's definitely 180 degree against
Yeah, I mean,
my culture of origin.
You can probably count on one or two hands how many Persian sexologists there are.
Right.
Yeah.
Exactly.
So, but let's go back to healing from codependency, and 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 now we just got noticed we're just about out of our second phase here. We're going to talk when we come back about how we can heal from codependency by dealing with the truth of how we were treated as children.
Okay.
Because that's the key, is the way we're treated determines to a large extent how we respond, and how we respond is either in a healthy way or perhaps a codependent way.
Exactly. More of this after our commercial break. Welcome back from our commercial break. Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. We're going to continue with our discussion about codependency and what we can do about it. And as soon as Dr. Robert joins us again, there he is. Okay, welcome back.
Thank you, thank you.
So, okay, we were talking about
the healing of codependency,
right?
And I said I was going to be asking questions of the audience,
right?
And so we talked about how free you were to say your truth in your family of origin.
I wasn't free.
Yeah.
You know.
Yeah.
But I said it anyway.
Yeah. And that and you are one of the few who were willing to take the consequences of that. But certainly it didn't happen without affecting you in a negative way, because certainly when you were 2 years old, you had to comply,
right?
You know, and so all of that affects us.
I would say the very first thing that people, codependent people, are afraid to stand up for themselves and say their truth is fear of abandonment.
Yes.
Right.
Yes.
And actually, that was the experience that I had. The prime experience that I had was I was actually abandoned.
You
right?
were.
And then, however, it depends on the personality, and I'm really thankful for God for giving me the personality that I have, because I turn around that abandonment in a source of freedom for myself, that now I can make my own choices and my own decisions.
Yes.
And I didn't let that abandonment kind of bring me down. As a matter of fact, perhaps I needed that disconnection in order to move forward.
Mm-hmm. Mm-hmm.
Right.
Yeah. But abandonment, remember, I'm talking to our listeners, abandonment to a child is the same as death.
Right. I mean, I wasn't a child when this happened.
Yeah, no.
Right.
But
right.
No, but I'm saying abandonment to a child. And so the child really doesn't have the freedom to stand up for him or herself when they're 2 years old.
Right.
Right. Or 3 or 4 or 5 even.
Right.
So during that time, if the parent is very controlling, and if the parent doesn't allow the child to speak what's true for them, because the parent has a different idea of who the child should be, or has a different idea of what the behavior should be, then the child learns, okay, I have to suppress my true feelings, and what I know. I have to hide what I know, and therefore I have to hide who I am.
Mm-hmm.
What we've learned in psychology is that we are born with our right brain developed. Our right brain is the creative part of us, and that's why children can sit and play with toys and have hours of play with toys, believing like my 2-year-old granddaughters now can sit and play, where they're at a mock kitchen, and they can pretend that they're pouring themselves some water and that they're drinking their tea and that they're washing the dishes, and their imagination is their creative part, and that part is intact, and also that's the part that is sensitive to emotion. So our right brain is born with emotions, which are all intact. our left brain, which is the part of us that learns about the world and develops logic and ways of looking at things, that takes the rest of our lives I mean, we can use that part of us the rest of our lives, and it takes at least until our teens and 20s before it's really online, where we can begin thinking like adults think and understand things from that point of view. And so what we need to know about codependency is that it being a disease of lost selfhood means that you have to be free to be yourself. Now, another question I want to pose to our listeners is, were there any toxic secrets in your family of origin that everybody knew about in the family, but that we couldn't talk about with other people?
Usually that's the case.
Yeah.
Yes.
And in my family of origin, my mother was very, very explosive, and she would go into fits of anger and rage, and that was something that it was a secret. I never heard my dad say anything about it. I never heard my mom say anything about it, even within our family, but she would do it. So she would go into these fits, and she would do things that were hurtful to myself and my sister, that were actually cruel. And because we were little, we didn't defend ourselves against it. And so it created a feeling there's something wrong, but because we didn't know whether this was true in all families, we didn't even know to talk about it. We just said, oh, well, this is just the way mom is.
Right.
Yeah.
As though that was normal.
We thought
Right.
of it as normal.
Right.
And it wasn't until I got into my own therapy in my 20s where I recognized, oh, that actually not only wasn't normal, it helped to make me codependent.
Right.
And affected my selection of friends, but mostly my selection of girls and women that I went with, and it really took the awareness of what happened in my family in order for me to begin to release some of the old beliefs. Because my father told me it's important to understand and to take care of women, and I thought, okay, that's my job. I have to understand and take care of women. But what about me? And I never thought, what about me? I always just accepted that was my job. And so then I sort of looked for women, certainly at the beginning of my life, that were kind of broken and needed to be fixed and needed to be taken care of. That's an example of what codependency can do to you.
Yes, exactly.
So ask yourself, were there toxic secrets? Were there things in your family that you weren't supposed to notice or you weren't supposed to talk about? Because and then if there were, then how did that affect you is the next question. What happened in your family that made you feel happy, relaxed, carefree, and able to express yourself openly? And what happened in your family that made you feel fearful, anxious, upset, angry? And how often were those things happening? Because if they're happening on a frequent basis, the chances are you grew up in a dysfunctional family. We now know that in the United States, the majority of families do have a level of dysfunction. They're not all the same level. But when you grow up in a dysfunctional family, you're more likely to sacrifice yourself in the service of being obedient to the rules or taking care of others in the family. And therefore, you don't get a chance to understand and develop your authentic true self, which is the opposite of what codependency is. So so in order to have a healthy relationship, you need to have an authentic true self that you bring into the relationship. Your partner has to have the same, so that you can talk about things and that you don't have to worry about saying the wrong thing. that you could, as long as you're polite and you want to be polite, and as long as you're respectful and you want to be respectful, then you share with each other your own thoughts, feelings, and beliefs. And if there's disagreement, it's okay, because that's what you're there for, is to learn and understand and still feel close, even though you don't agree on everything.
Exactly. Yes. And being able to say your truth. I can talk about my own experiences. Being able to say your truth while people are rejecting your truth, and as though you are wrong to say what you're saying, and you're wrong for having the opinion that you have. It's not an easy task, right? Especially when those rejections, when those negative comments, where those inhibitions are given by your loved ones, by close family members, by siblings, by cousins, by best friends, and all of that, right? And then when you see that you're by yourself in this world, that is no codependency there for yourself, but you are there, associating with a group of people that they believe their way of life is the correct way, and you're the only one who's different, right?
Mm-hmm.
It is challenging. It has its own challenges. But then again, as long as we stay truthful with ourselves, as long as, we see that, I can be me and they can be them,
Mm-hmm.
right? That's fine. That's fine to be different. That's fine to, take different actions, make different choices. And for so many people, they say, but if I do that, I'm not going to be invited. If I don't do this, I'm not going to be included. What would I do without my family? What would I do without everybody else? It is as though if you are no longer a codependent, or if you have never been a codependent, you're losing everybody. The reality is you're not losing anybody. You can be yourself even among a group who are codependent.
Well, so that's an interesting point, and I'm not sure that I totally see it that way.
Yeah.
Because I think when if we are in a dysfunctional family system, and we want to be our authentic true selves, we no longer fit in with that system.
Yeah, we're not going to fit in with that system, but it's not as though we have to disconnect from the system.
Well, again, I'm not sure if I agree.
Okay.
Yeah, because
how can you disconnect from your parents?
Well,
you can disconnect from your parents, but you don't have to live their life as yours.
So the reason that I'm disagreeing is because if you find that whether it's your parents or your siblings are people that you feel as though you have to give up being your authentic true self to be around, then oftentimes you have to make a tough decision, which is to say, if I'm around people and I don't feel good about it, I keep sacrificing bits and pieces of myself to be around them. And I'm not suggesting anything for any individual, but I think that when people are abusive with us, whether they are our parents or siblings or anybody, and we have tried to express that we don't like to be treated in that way, and they continue to treat us in a way that is hurtful to us, unfortunately, I think sometimes we have to make those tough decisions.
I see that as well. At the same time, my experience has been that coming from a different culture,
Mm-hmm.
right? I can see that it's easy in individualistic culture, but
Mm-hmm.
for myself, coming from a collective culture, I have learned to accept the differences. And it doesn't mean that when I'm among, my family, I'm not myself, and they know that. So I had to teach them this is who I am and this is how I want to be treated. And then acceptance of our differences has made it so much easier on myself to keep my interaction, not like it used to be, obviously, right? But it didn't take me to a place that I want to have a total disconnection with them.
No. What I'm saying is that if you have a family that does accept the differences and does respect your differences, then that's different.
Right.
If the family is constantly putting you down because of the differences.
Oh yeah, that's a different.
No,
yeah.
That's what I'm saying. And I'm not by any means trying to say that it's an easy thing to do.
It's not.
It's not.
It's not. Believe me.
But I have worked with many people over the years that I've been doing this, whose families do keep telling them that they are bad and wrong for the changes that they're making within themselves. And I think that, and unfortunately, sometimes we have to cut off a finger in order to save the hand.
Yeah, cut off a finger or cut off those emotional ties.
Yeah,
exactly.
Yeah.
Yes.
So I know that we're just about out of time.
Right.
I hope people have gotten something from this.
I'm sure they will, and I'm sure they have, and we appreciate, their participating in this program and staying with us. I would like to invite you to please join us again Thursday afternoon at 3 p.m. and also Friday at 9 a.m. where we talk about human sexuality and, again, other aspects of codependency, relationship and trauma and addictions. And until then, don't forget that all you need is love.
Love, love, love.
Have a wonderful weekend.
Okay, bye-bye.
The preceding was a paid program. Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed are not necessarily those of radio station KMET, its management, employees, or affiliates.